Good evening. My name is Mary Kamau, a registered clinical nutritionist working at AR Healthcare Nakuru. And this evening we will be talking about the role of nutrition in the prevention of lifestyle conditions and lifestyle management. Welcome. Our objectives for the presentation today, we'll be talking about healthy living and the lifestyle diseases, the risk factors that expose people to lifestyle diseases, examples of lifestyle diseases, and I'll give you an example of the common lifestyle diseases that we have. And at the end of the presentation, we'll talk about the role of nutrition in the management and prevention of the lifestyle diseases. What is healthy living? Healthy living means a healthy lifestyle, introducing habits that improve your health. A lifestyle disease is a medical condition or a disorder associated with a person's health and habits that is linked to the way he or she lives their life. So what you do on a day-to-day lifestyle, on a day-to-day life, is what influences the lifestyle diseases that you might get. Currently in our country, over 30% of Kenyans that we have are hypertensive, and over 3.3% of them are diabetic. So what caused us to get to this point as a country? One, our lifestyle have changed, our diets have changed, and we've moved from fast food, from whole grain feeding to fast food feeding. Again, a high population of our country is consuming high refined foods. We are taking high fat foods. We are taking a lot of processed foods. We are indulging in a lot of alcohol, and have decreased our physical activity level, leading to an increase in the lifestyle diseases that we have. Again, we have embraced a sedentary lifestyle. Most of us are assisted most of the time. Most of us are inactive and feeding. That's why lifestyle diseases have now become part of us, and the conditions have increased. What are the risk factors for developing lifestyle diseases? We categorize them into two: non-modifiable and modifiable diseases. When you're talking of the non-modifiable diseases, the conditions, these are the conditions that you cannot change. These are the things that you cannot change. Your age, you cannot change your age. You cannot change your genetics. You cannot change your family history. You cannot change your gender. You cannot change your ethnicity, and you cannot change your race. So these are the things that cannot change but are a contributing factor to the lifestyle diseases. What are the modifiable risk factors for developing lifestyle diseases? Physical inactivity, poor stress management, poor dietary choices, tobacco use, alcohol abuse, and sedentary lifestyle. When I talk about sedentary lifestyle, I am meaning a lifestyle where most of the time you are seated, you are inactive, and you are mostly in a slow state of life. That's what I mean by sedentary lifestyle. Some of the example of the non-communicable diseases, especially the common ones that we have, are divided into four. Cardiovascular diseases. These are diseases of the heart. Cancer, chronic respiratory diseases, for example, asthma, diabetes, hypertension. These are the common lifestyle diseases, that non-communicable diseases that we have. When we say non-communicable diseases, we mean conditions that you not get from a bacterial infection or a viral infections. These are diseases that come due to the lifestyle that you live. Other types of non-communicable diseases include obesity, metabolic syndrome, cerebrovascular diseases, osteoporosis, depression, and non-degenerative diseases. We'll talk about the first non-communicable disease that we have, obesity. What do we mean when we talk about obesity? Obesity is the accumulation of excessive fat resulting in weight gain beyond the recommended range of a person's height. Being overweight or obese increases your risk of diabetes, it increases your risk of hypertension, and it increases your risk of cardiovascular diseases and some types of cancers that we have. So how do we categorize obesity? We categorize obesity by taking your weight and your height and coming up with something we call the BMI, basal metabolic index. For underweight, we categorize them with a BMI of below 18.5 kilograms per meter. A normal BMI is between 18.5 to 24.9 kilograms per meter squared. When you are overweight, you are 25 to 29.9 kilograms per meter. When you start categorizing obesity, is a BMI of 30 and above. And for obesity, we categorize it as obese grade 1, 2 as we move on. But BMI is not a standard parameter when it comes to to categorizing obesity. We also use something we call the waist to hip ratio. This measures your waist compared to your hip, because when you deposit fat around the midsection, that is what predisposes us to most of the lifestyle diseases like diabetes and hypertension. So for women, we talk of a waist to hip ratio of 0.8 or below. That is a low risk of you developing the lifestyle diseases. Waist to hip ratio for women 0.81 to 8.5. That is moderate. You are at risk, but you still need to work on your weight. A waist circumference of 0.85 and above, you are a higher risk of developing some of these lifestyle conditions. For men, we use a waist to hip ratio of 0.95 or below, 0.9 for moderate and 1 for above. If you want either of these parameters to be taken for you, please visit our facility at AAR Healthcare. We also use other parameters such as total composition analysis, whereby when you are taking your weight, we find out your bone density, we find out your fat ratio, we find out your muscle mass. That will also, it categorizes and works on the total weight of the body, because the weight is not only what we see when we step on a scale. It is also the fluid that we have, the muscle that we have, the fat that you have, and your bone density contribute to your overall weight. So when you're talking about weight management, we factor in all those things, so that when you're telling you to lose weight, you're telling you either to lose fat because your muscle and your bone density is okay, or we are telling you your fluid retention is high, so we work on reducing your fluid retention. That is for obesity. And the major contributing factor for obesity is the lifestyle and the feeding that we are doing. When it comes to hypertension, at the moment, the incident rate for hypertension is high, and it's at a critical level in our country. Likely deaths to come from hypertension in our country at the moment is at 6.1% of patients who are diagnosed as hypertension are now on medication. But some of the conditions that we have for hypertension can be easily managed by lifestyle adjustment and regular clinic checkups to check your BPs. The risk factors for developing hypertension are smoking, obesity, low activity level, and poor feeding and high intake of fatty foods. For hypertension, we usually look at narrowing of the blood arteries due to an increase of fat or cholesterol. So when you come to our facility at AAR Healthcare, we will take your cholesterol level test, find out whether the good or bad cholesterol are within normal, and then give you the necessary management, whether it is lifestyle adjustment or we will require to put you on medication to work on your cholesterol levels. Largely the plaque that deposited usually in the arteries is usually fat or cholesterol or cellular waste or fibrin that can cause clotting of the blood, leading to narrowing of the blood arteries. Again, when you're talking of hypertension, what do we mean when you talk of hypertension? Are we talking of pre-hypertensive? Because I know a number of people go to normal clinic checkups, and one time you've been told that your BP is elevated. What do they mean when they tell you that your BP is elevated? A normal blood pressure level is, we say, a systolic of 120 and a diastolic of 80. When you're talking of pre-hypertensive, we talk of a systolic of 120 to of 129. When you're talking of stage 1 hypertension, we are talking of your blood pressure being anything between 130 to 139 systolic and diastolic 80 to 89. When you're talking of stage 2 hypertension, we are talking of a systolic of 140 or higher, or a diastolic of 90 or higher. A hypertensive crisis, this is where BP now lands you in a admission case. We are talking of systolic of 180 and diastolic of 120. Anything above that will land you in a hospital setting for admission. So the moment you go for clinical checkups, or when you're just going for a facility, and the clinician or the nurse that you find at the triage tells you that your BP is elevated, you need to take that as a warning sign and start monitoring your BP over a 1 week period as you're recording that BP. Then after 1 week period, come to the facility with those readings, and we will advise you accordingly whether to put you on medication for hypertension or whether we need to start doing lifestyle adjustments, and then we'll do further checkups and find out whether your cholesterol levels are high. And with high cholesterol levels, again, we will start you either on medication depending on the level where the cholesterol is, or lifestyle adjustment might work. And people have started a lifestyle adjustment and have normalized their BP levels. What are the consequences of unmanaged hypertension? Most of the patients, when they come to the facility, the first thing they tell you after their BPs have been told they're elevated is they don't want to be put on medication. So what do we do about it? What are the risk factors of you being put on medication and stopping the medication, or not starting the medication for hypertension? It can lead to hemorrhagic stroke. Hemorrhagic stroke is bleeding on the brain, where a blood vessel pops on the brain and it leads to a bleed that can lead to a stroke. It can lead to memory loss. It can lead to ischemic stroke. That is where a clot forms on one of the arteries around the neck, and the clot moves to the brain and you suffer a stroke. It can lead to an enlarged heart. It can lead to blocked blood flow, kidney failure, and blocked arteries, or narrowing of the arteries, what you call atherosclerosis. So these are some of the conditions that might come in unmanaged hypertension. So please, if at any one time you've been told that your BP has been elevated, that is your body sending you a warning sign, and you need to take it seriously. The other lifestyle condition that is very common and has been on the rise of late is type 2 diabetes. By that type 2 diabetes, it is elevated blood sugar levels above the normal range. What are the normal ranges for diabetes? A fasting blood sugar of between 3.8 to 5.8, and a random blood sugar of between 5.4 to 7.8. That is what we mean by elevated blood sugar levels. What are the types of diabetes? There is type 1 diabetes, gestational diabetes, pre-diabetes, and type 2 diabetes. What causes it? Diabetes. Diabetes is caused by insulin resistance. Type 1 diabetes is where usually it's common in children between the ages of 5 years. It presents between the ages of 5 years to 17 years. Type 1 diabetes is where your body completely does not produce any insulin, and we call that person insulin dependent. You depend on insulin for your day-to-day running. Gestational diabetes is diabetes that usually comes when you're pregnant. Your body starts having insulin resistance during the pregnancy period. Pre-diabetes is where your sugars now start having a slight elevation and a test, what we call HbA1c, of between 6.5 and 7. That is what we call pre-diabetes. Type 2 diabetes is where you have insulin resistance, and management for type 2 diabetes is lifestyle management and physical activity and oral medication. Okay. So for pre-diabetes, I've said we are talking about blood sugar levels of between 7.8 to 11. To the facility and you've been told that your sugars are elevated and your blood sugar is between 7.8 and 11 millimole per liter. So that's where we talk about pre-diabetes. When you're at pre-diabetes phase, is where now we can start working on your lifestyle to avoid you getting to a place where we are now on full-blown diabetes and we start putting you on medication. So what are the symptoms of insulin resistance? What shows you that you are diabetic? People come to the facility with excessive thirst, excessive urination, weight loss, hair loss, a fatty liver, gout. People also, some present with weight gain, skin tags. Some people also present with acne. So if you have any of those symptoms, especially excessive urination at night, excessive thirst, excessive hunger, and you're presenting with weight loss, come to the facility and get your blood sugar levels checked. If diabetes is left uncontrolled, it can lead to vision loss, it can lead to kidney damage, it can lead to nerve damage, diabetic foot, stroke, and heart diseases. Usually diabetes and hypertension usually go hand in hand. Most patients who present with diabetes, later on they might present with hypertension, and those who present with hypertension sometimes present also with diabetes. So it's good to manage one of the conditions if you have it, to avoid you getting the other condition. The other lifestyle condition that we have that is very common is cancer. What do we mean by cancer? It refers to one enlargement of abnormal cells that divide uncontrollably and have the ability to infiltrate and destroy the normal body tissues. Cancer at the moment is the leading cause of death in the world, and the cases have now become so rampant, and the survival rate has improved due to the increase of screening and treatment and prevention of some of these cancers. And since it's a lifestyle condition, your day-to-day life can help prevent you from getting some of the common cancers that we have at the moment. What are some of the signs and symptoms that we have for cancer? This is a general sign and symptom because it's not specific to one specific cancer. So we talk about fatigue, where you're feeling excessively tired. We're talking about a lump or an area of thickening that can be felt under the skin. Weight changes, either you are gaining a lot of weight over a short period of time or you are losing a lot of weight over a short period of time. Skin changes, where you find that your skin is yellowing or darkening, or there is redness, or sores that will not heal, or changes in moles. If you have a mole, is the black things that usually appear around your skin. If you find that you had a mole here and it was very small, then over a short period of time you see that mole is enlarging, you need to get it checked. Changes in your bowel movements. If you are going for bowel movements once a day, all of a sudden it has changed to once a week, or the frequency has increased. You are going once and you are going for bowel movements 2 to 3 times in a day. You need to have that check. A persistent cough or trouble in breathing, difficulty in swallowing, hoarseness, persistent indigestion and discomfort, persistent unexplained muscle or joint pain, persistent unexplained fevers and night sweats, or unexplained bleeding and bruising. So those are some of the symptoms that we have for cancer. So after all this is said and done, what is the role of nutrition in managing of some of these lifestyle diseases that we have? The role of nutrition in managing, we need to increase, one, your physical activity. Physical activity can be something as simple as avoiding the lift and using the stairs, walking where mostly you take a boda, walking where mostly you drive. You increase your physical activity in your day-to-day life. Physical activities does not necessarily warrant you to go and register for gym membership. You can do physical activity just in your day-to-day activities that you're doing. Managing stress. Stress management can include a number of things. Talking to someone if the stress is too much, debriefing from social media if you've been on social media for a long time, and those are some of the things that can help in stress management. Improving your sleep. Sleep is very important, especially when it comes to insulin resistance. So aim for at least 7 to 8 hours of sleep every night. Cessation of tobacco use. Tobacco, according to the research that has been searched, has no benefit to the body and causes more harm than good. So cessation of tobacco use. We do not even talk about reducing tobacco use, we talk about stopping tobacco use. Healthy eating. Healthy eating, we talk about mindful eating. Before you serve that food on your plate, ask yourself, is this food beneficial to me or not? Is this food nutritious or not? Is this food balanced or not? Because with the life that you're living right now, we just eat so that we can move and the day moves on. So we need to be very mindful with whatever we are eating. Okay, something else that we can do. Start now finding out our family history of non-communicable diseases. Ask your parents, is there a history of diabetes in our family? Is there a history of hypertension in our family? So that we can be able to start managing. If you know there's a history of diabetes in your family, you'll start making the changes for you to avoid getting to where your relatives got to. Get screened. Go for regular checkups. Come at AAR Healthcare, we will do health checkup for you. We will do your weight, we will do your BMI, we will do your body composition analysis, cholesterol. We will also do your blood pressure levels and your blood sugar so that you can find out how you're doing. Make healthy choices at school and at work. Make sure that whatever you are eating, you are thinking about it. Do meal prep. Make sure that you have healthy foods in the house. Avoid buying unhealthy foods in the house. Because if you do not have soda in your house, you will not drink that soda. If you don't have biscuits in your house, you will not have those biscuits. Avoid buying them so that you can make healthier choices. Other nutrition healthy practices that you can adopt, healthy food portions. I know that this has been talked about most of the time, but what do we mean by a healthy food portion? We are talking about the plate model, where half of your plate should be carbohydrate, quarter of your plate, half of your plate should be vegetable, quarter of your plate should be protein, and quarter of their plate should be carbohydrate. When you're talking of carbohydrate, you talk of the fist size. Your fist size, this is the amount of ugali you should be taking. When you're talking of protein, your palm size should measure for you your protein. And for your vegetables, half of your plate at any one given time should be vegetables. Again, we need to start creating a culture of reading our food labels. Before you purchase that food, have you read the food labels and find out the ingredients that are in the food? The amount of sugar that is in that food, the amount of calories that is in that food. We need to start embracing reading of the food labels, and we need to start practicing mindful eating and healthy feeding as we go. As I usually say, you are what you eat. Whatever you eat, that is the outcome that your body will show you. If you are eating junk food, if you are eating a lot of sugar, if you're not exercising, your body will definitely show you. If you're eating whole grain foods, if you're eating your fruits and your vegetables, your body will also show you. So you are what you eat. What you eat is what you are. When you talk about stress management, because that is also another factor that is very common, especially for us as Kenyans at the moment, you need to take care of yourself through healthy feeding. You need to make sure that you're doing preventative measures like taking a walk. You need to start talking to the people around you. You need to make good company that you can be able to talk to. You need to start reading more and reducing more on screen time, and make time to unwind and do activities that make you happy. Avoid drugs and alcohol use when you are stressed, because it may seem that it is helping you at that time, but it is causing more harm than it is supposed to be helping you. And equip yourself better and know yourself better and know how to manage the stress that we are dealing with. In summary, what we are trying to say, just try and make better dietary and lifestyle changes. I insist again, do regular checkups. Do regular checkups biannually or you can even be passing by any facility, get your BP checked, get your blood sugar checked, and on a yearly basis, do medical examination on a yearly basis just to find out how your body is functioning. Early detection can save lives. And some of the recommendation of the wellness checkups that you usually do at AR Healthcare include doing your kidney function test, your liver function test. You can do your tumor markers, ECG, lipid profile, blood sugar test, blood pressure, weight and BMI assessment, infectious disease screening like urinalysis, stool microscopy, complete blood count, and a HbA1c. Thank you very much for listening to me. I will now take a few questions from our social media page. Please post your questions on the comment section. I'll be taking questions from there. Welcome back. I'll now read some of the questions that we have on our chat box. From Dell, you are asking, if obesity or being overweight is a genetic factor for a person, will physical exercise and diet be enough, or does one require further medical assistance when it comes to weight loss? We have said genetic factor is a non-modifiable risk factor for you to develop obesity, but your life choices and your day-to-day decision will contribute to your overweight. If in your family you know that there is a predisposition to being obese, again, if you are just eating a lot of junk food, not doing any physical activity, you're eating the wrong things, you're not watching on the portions, obviously you will also become obese, and you'll continue with the same trend. But if you as a person decide that now you will change your lifestyle and improve on your physical activity, and also teach your family about healthy eating and portioning of the meals, then you might have come to change the normal projection of your family. So yes, it is a non-modifiable, but your decision as an individual will contribute to you either being overweight or obese. Will one require further medical assistance? Yes, if you know that there is history of some of these lifestyle condition in your family, it's good to do early screening, regular checkups, just to find out if you are falling in that line. Thank you very much for your question. The other question that you have from Patrick Kenywa, you are asking, how much do you charge for annual wellness checkup? For the annual wellness checkup, you need to come to the facility at AAR Healthcare, and if you have medical insurance, we will check on the package for the medical insurance, and we will do the wellness checkup authorized by the medical insurance. Also, we can come up with a package for wellness for you when you come to our outpatient centers. Another question from Dell. I have seen people maintain a healthy weight despite having a poor diet or doing little to no exercise. Could this overall health be in danger, or how do you approach such a situation? Dell, I know you're talking about the people who eat, you're seated with them, they eat and eat and eat, you add weight and they do not add weight. Most of these people, you find that they have maybe a high metabolism, so their food is being used up fast. But there are also people we call skinny fat people. You are very tiny, but when you come to the facility, we check your cholesterol levels, they are over the roof. So being tiny or you not gaining weight fast does not warrant you to eat whatever you want. You still need to eat a healthy diet, and you find that most people who know that they gain weight faster tend to be more mindful of what they are eating than the people who do not gain weight faster, because they know if they sit and relax and not do physical activity, they will accumulate the weight faster. But the skinny people tend to think since they cannot gain the weight faster, they eat whatever they want. But again, most of the time in my line of work, I've seen most of the people who are skinny tend to have the highest cholesterol. So let that not fool you that the skinny people are the healthy people. Let me check for another question. Kindly send in your questions. How often should one get a wellness checkup? Again from Dell. Thank you very much, Dell. You seem to be very attentive. How often should we get a wellness checkup? A wellness checkup for full body workup, at least on an yearly basis. Come to the facility, get everything checked. Your kidney function test, liver function test, cholesterol levels, HbA1c, your tumor markers, and also biochemistry, your urinalysis and stool analysis, just to make sure that when you're starting a new year, you're starting it on a clean slate and you know that you're fine. Okay, does lifestyle adjustment from Hellsgate Biking, does lifestyle adjustment mean change in diet? When you're talking of lifestyle adjustment, it is not just about whatever you are eating. Lifestyle is overall your diet, your physical activity, stress management, and how generally you live your life on a day-to-day basis. That is what we mean by lifestyle adjustment. So it means you need to adjust your diet, what you are eating. It means you need to improve your physical activity. It means you need to improve your mental state. It means that you need to improve your sleep. It means that you need to improve your general well-being. That is what we mean by lifestyle adjustments. Yes, I think I've tackled the questions that are there. Unless there is any more questions that we have. I cannot see any more questions. Thank you very much for tuning in for the live interview, and you're very much welcome at AR Healthcare Nakuru. You're very much welcome at Healthcare Nakuru. We are located at Gido Plaza, ground floor, and we have a new branch at section 58. You're very much welcome. Thank you.